Hello, everyone. My name is Rakia Anumegi, and I'll be going over the initial stage case scenario one of our patient L in relation to our health promotion with folic acid. Just to recap a little bit, we do know that our patient L presented to her primary care physician's office, feeling weak with extreme nausea and vomiting, and just not feeling well. We concluded from our introduction and from our laboratory studies that the patient was, in fact, pregnant. She was then prescribed Zofran and then to follow up with her OB. That brings us to our first case scenario. We do have where patient L notices very little symptom improvement from the medicine, the Zofran that she was prescribed, and she's still feeling nauseated and she's still lacking the energy. Well, because her OB appointment is 3 weeks out, she has presented back to her primary care physician with concerns that the nausea and vomiting may be depleting her of the nutrients that she needs to get to her baby. So when we say folic acid, let's talk about that. The words can be used interchangeably. Folate is the actual vitamin that you get from the B vitamins, and that's found in your dark leafy vegetables, your lentils, your beans, your liver, eggs, and sunflower seeds. The folic acid is the synthetic form of folate that's found in our fortified foods and supplements, and it has to be converted into an active form in the cell. So going back to our patient L, let's look at her labs. We noticed that her labs are all normal except for her sodium. We've did a repeat of her ketones and they're now negative. We can conclude from this that we do know now it is important to start educating our patient on folic acid due to pregnancy. So it's important, as from the introduction, to get a complete health history as much as possible. We also need to get a complete examination with special attention to fatigue, weakness, and tachycardia. And we also need to obtain laboratory studies. You can also conclude with this patient so far in the beginning stage that she's going to have a nursing diagnosis of nutritional imbalance, which is going to be less than the body's requirement. Due to many pregnancies are unplanned, I doubt the patient was taking prenatal vitamins or folic acid, so she would probably also have knowledge deficit related to drug therapy, meaning she doesn't really have much information on folic acid and what she should be taking, as well as she could probably have health maintenance impaired related to maybe insufficient knowledge of how much folic acid to take or prescribe. So for the nursing interventions, we've listed them here for her to consult with her obstetrician about the folic acid, to eat small, frequent meals. This is going to help with the nausea and vomiting, as well as substitute an enteric-coated vitamin to help with that as well. We wanted to continue to keep her 3-week appointment to follow up in her OB office and to increase her fluid intake. That's due to the low sodium. So let's ask some questions in this initial stage. What vitamins should all women of childbearing age take? That's something to think about. Based on the patient's history, why would she need folic acid? And does severe nausea and vomiting in early pregnancy place the patient at risk for any type of defect in the infant? And some of these questions, if you think about them in your head, were kind of discussed in the introduction and from looking at patient L's examination and laboratory studies and health history. So let's look at the answers. Have you thought about it? Okay, let's see. Well, folic acid is important right from the very moment that your baby is conceived. And since many women can be pregnant for 8 weeks before they know it, then you need to take the folic acid prior to conception to ensure that the baby has a good supply. Our body doesn't naturally make folic acid, so we need to make sure that the baby is getting enough of the nutrients way ahead of time before we even become pregnant. Question 2, about the patient's health history. So we were asking, based on the patient's history, do we think that the patient will be in need of folic acid? Most definitely. We see that the patient has an unknown family history. So we don't know if maybe mom may have a problem in digesting B vitamins. We also saw that the patient has PCOS. A lot of times that can have an effect in cholesterol levels and glucose metabolism. And the patient is nauseous and vomiting with poor diet and unplanned pregnancy. So those are definitely key factors in needing folic acid early on. And then we asked about severe nausea and vomiting in early pregnancy, if we thought that had anything or any relations to a defect in the infant. And that has been proven to be a yes. Morning sickness in pregnancy could result in poor dietary diversity, thus reducing the energy, the protein, and the micronutrients that could affect an infant's outcome. Okay, we're now going to go ahead and go into our second case scenario of our patient with folic acid. Thank you.